we are back with the Wellness Warriors Collective. I'm Dr. Melissa Leedy, clinical health psychologist.
And I'm Tiffany Turner-Coats, board certified health and wellness coach.
Yes. So we are back today. We're going to just give a little bit of information about sleep and some of the things to think about if you are having problems falling asleep, staying asleep, waking up too early. Those types of things.
Right.
So, yeah. You want to start off?
Yeah. So I think around the topic of sleep, I think a lot of people understand it as like, if I'm just not getting enough sleep, it just affects maybe my energy level and my mood. When in all actuality, it affects, a number of things, including cognitive function, physical activity, levels. I mean, it affects so many things, right?
Right. And I think the problem really starts when you are you're having chronic sleep problems.
Right.
So, one of the things about it is a lot of people get really anxious about their sleep and they say, well, I have to have 8 hours of sleep a night.
Right.
Which is, it is really nice to have that much sleep. But a lot of the research shows that the amount of sleep people need varies, and it varies based on their age and obviously on what they're doing. But, you really need to be thinking about like what number of hours of sleep works for you. Like I am optimal at 9 hours.
Ooh.
I never get 9 hours.
Oh yeah. I'm like
very,
9
very
hours.
Woo, but when I get it, I am like Superwoman.
Yeah.
So, but, a lot of the books would just say stick to 8, but.
Right. And then I think a lot of things say, a lot of research recently says, at minimum, especially with women, 7 hours is minimum just to help regulate your normal bodily functions.
Right.
Yeah.
Right. Because it is also a lot of like hormone involvement. Cortisol, your thyroid. Obviously, like if you are a woman in perimenopause or menopause, you've got progesterone and estrogen and testosterone playing a role in there.
Right. That can really disrupt your normal sleep. So, and I think too, when, like you said, when there's a lot of anxiety around sleep, which then causes people to sleep even less, I think getting into a healthy sleep hygiene routine, I think a lot of people, don't really know where to start with that.
Yeah, so with sleep hygiene, let me just show you this book. I love this book. It's called Quiet Your Mind and Get to Sleep. It's by Dr. Colleen Carney and Rachel Manber. And they've done a lot of training of different professionals for sleep and things like that, and insomnia and circadian rhythm disorders and things. But in this book, this is the self-help workbook, and you can get it on Amazon or wherever. But what's nice about it is they go through several things in this book, but one of those things being the sleep hygiene. Now, sleep hygiene is like not the end-all be-all, right? Because you've also got other factors like conditioned insomnia and
100%.
Sleep restriction, different things like that.
Right. Interferences with medications, like you said, hormones. Right. So that is definitely not the end-all be-all, like as far as solutions are concerned.
But I think when you are doing sleep hygiene, I think one of the things that a problem people run into is they make too many changes at one time, and then they might only do it for 2 or 3 nights, and they say it didn't work.
Right. When making any change like that, it takes time, and it's almost like a slow build. It's like doing a couple of things, maybe a week, and then you're instituting a whole new sleep routine essentially within a month. You're not trying to go like 0 to 100. Right. I've got to change everything. I have to cut my caffeine down. I need to make sure everything's really dark. The temperature needs to be lowered. We know those things. But
so I always say that if you're going to make some changes to your sleep hygiene, just do like one change per week. So like Tiffany was mentioning, making sure it's really dark or cutting back your caffeine. We were actually just talking about coffee just before we got on.
Because we love it.
Because we love coffee. And I was like, well, I shouldn't have this cup of coffee this afternoon because right now it's 1:45, and I know that if I drink caffeine after 1 p.m., I'm going to have a hard time falling asleep. So, one aspect of sleep hygiene is cutting back on caffeine and not having any caffeine, and usually past 12 or 1. You don't want to have any caffeine past 12 or 1.
Right.
Because it stays in your system significantly longer than what we think.
Right.
And it causes problems falling asleep.
Right. Well, and our bodies react to caffeine differently as we get older. So, maybe 2 years ago, I could, I'm, doing millions of events, whatever, and I'm having caffeine because I'm staying up, so much later or whatever, but it would be fine. I could go to sleep, no problem. But now, like, I'm a hard, 2 o'clock cutoff. If I have caffeine after 2, I'm not going to be able to sleep at all.
Right.
So, some things are, like you said, you just have to kind of find what works best for you because everyone, really tolerates that stuff differently.
Right. What are some other sleep hygiene things that you really see people needing to do?
I would say screen time is another really big one. And,
do you mean like phones in bed? That type of thing?
Phones in bed or, Kindles, even reading. I mean, which reading is really relaxing, but if you have, that level of like blue light, then that affects your, your sleeping patterns essentially.
Right.
So I say, and a lot of research shows at minimum 30 minutes before, just completely done with screen time.
Right. Yeah. And try to do something else relaxing.
Yes.
In bed. And if you're going to read, if that's part of your evening wind down time or something like that, it's okay to read, but try not to read in bed.
Right.
If you can. Or worst case scenario, if you're going to read in bed or do something like that or be on your phone in bed, try to not be on the side of the bed where you sleep.
Right.
Because your body gets conditioned
yes.
to your area of the bed. It gets conditioned to sleeping, in that way. And so, worst case scenario is read or do whatever on your non-sleeping side.
Right. Or, and also, if you do want to reading, a hard copy of a book.
Right. What is
well,
that?
I know. I love it. That's my move. I could literally fall asleep with a book in my hand.
I guess that also would, thinking about listening to audiobooks.
Yes.
Right? The other part of sleep hygiene, if you're going to be listening to something, whether it's an audiobook or you're reading something, a lot of times people will be listening to something like a psychological thriller or something that just really captures their attention. And so then they get really into it and their nervous system gets activated. And that's the exact opposite of what you want to happen when you're trying to go to sleep. So, probably something, you need to read something or listen to something that's maybe a little bit boring.
Yes. Yeah, just a smidge. Or maybe you're doing research on something,
Right.
Then that's something that definitely kind of lowers that stress level. I'm not going to be stressed out when I'm researching gut health. I don't know. Maybe I am. But another thing, a lot of people like to do white noise. I love the Calm app and listening to a story. I know, which sounds crazy as an adult.
I love Headspace.
I never.
It's my favorite.
Matthew McConaughey, Green Light. I never make it through a whole story. They are so good.
Yes.
I am just I'm just relaxing, and then I'm out, and then it goes off, and my phone's already turned over and away from me. Right. So it's amazing.
Right.
Yeah.
For the most part, your bed should be used for sleep and sex only.
That's it. Yeah. And they're even saying now, research is saying don't even have a TV in your room. Or, if you do, like you said, switch to the opposite side that you normally wouldn't sleep on. And again, make sure it's off, before.
Right.
Yeah.
Yeah. Another really good sleep hygiene tip is to try to have your wake up time be consistent, mostly across the 7-day week.
Right.
Obviously there might be a little bit of sleeping in, 30 minutes or things like that. But generally speaking, you want to be getting up at the same time every single day because that starts your whole cycle, your whole circadian rhythm cycle, your cortisol cycle, all these different things. And your body really likes that routine and that structure of knowing what to expect.
Right. 100%. So I set my alarm for 5:01 every, that's just my recurring, not on the weekends, but I wake up, between 4:52 and 4:57 every day. I never, it does not matter what's happening.
Right, because your body is now on such a schedule, it just kind of does it automatically.
Right.
And then I bet on the weekends, you probably don't sleep too much.
Oh, no.
You're probably awake around 5:30, 6 o'clock.
Yeah.
Naturally.
Yes.
That's good. We want our bodies to wake up naturally because we're going to be more rested and our bodies are just naturally in that routine.
Well, and naps. I think that's a big thing too.
Right.
If you're having issues with sleep, obviously, taking a nap throughout the day, that's great. That can help you, obviously still cut back on caffeine and feel a little bit more rested. But, maybe it's something like pushing the naps earlier in the day because, having a late afternoon nap can still affect your
Right.
Yeah.
Right. It's like a sleep snack.
Yeah.
You
Yeah.
don't
It's
want-
like a 20, 20 minutes is.
Right. Like a sleep snack is good.
Yes.
So,
Sleep. Yeah.
so like 20 minutes,
Yeah.
15 to 20 minutes, you're not going to get into a really deep sleep cycle.
Right.
You're just going to kind of be on that verge where you're like half awake, half asleep.
Right.
But really, if you do a sleep snack, a nap, then you really want to do that before, I'd say maybe 2 p.m. That way you have enough time in the day to use that energy up so that your sleep driver system, which is basically like how much gas you have in your gas tank for your body, your sleep driver system has used enough of that energy so that you can get sleepy at night.
Right. So it's not getting confused. Like, oh wait, am I off? Am I supposed to be sleeping like 6 hours ago, or is this when I'm actually supposed to kick it off?
Right. I think the thing is like as adults and even as teenagers, our bodies still like the same routine and same structure, just like what we do with kids. Right. Like with kids when they're babies, like we like to try to create routine and structure for them and predictability. And our bodies as adults like that very same thing.
Right. That's a perfect analogy, because what would we do for our kids? We would give them a bath. We would read them a book.
We would help them to relax.
So that is essentially, the same thing that we should be doing for ourselves. Right. I mean, to, really impact our qualities.
Right. Yeah. We make it pretty confusing and difficult as adults.
Right. Yeah. Right. I mean, we just have a couple of more things that we're managing,
right.
Like lives.
Adulting is hard.
Yes.
But I should have said, or we should have said, just a couple things about like what insomnia is. So insomnia is where you are struggling to fall asleep, stay asleep, or you're waking up significantly earlier than what you want.
Right.
And so you can have all three of those things. You can have two, you can have one.
Right, you can have one.
But if you're having those things more times throughout the week than not.
Right.
And it's going on for at least, a couple weeks, then at that point, like, you have insomnia.
Right.
So that's where you might really want to start looking at your sleep hygiene. Read some reputable stuff, like anything from like cognitive behavioral therapy for insomnia, anything by Dr. Manberg, Dr. Carney. At Legacy, we do sleep work here.
Right.
Tiffany does sleep work. A lot of the therapists here do sleep work. And start to understand what that is. And the other part of it is... oh my gosh. I just have a brain fart.
This is what happens. You were going to say something really good, though.
I know. Yeah. I can feel it. It was going to be really good.
The other part that we'll remember for the next time we talk about sleep, I guess.
Oh, I know what I was going to say.
Okay.
Let's see, it came back to me.
We're back.
And this is a result of poor sleep for 2 nights. So
yes,
now you know this is what happens for me when I have poor sleep for 2 nights. But anyway, in this book, and there's also an app, a VA app called Insomnia Coach, and that app is really, really great. And there's a sleep diary on there. So whether you are doing cognitive behavioral therapy with a coach or with a therapist, or you're working it on your own, or you're looking at the app or this book, make sure you are logging your sleep, because we have a really poor memory for how our sleep was 3 days ago, even last night.
That's such a good point. Yeah. And there's a lot of apps too, like, so Calm. I don't know if the one that you're talking about. I mean, so say I listened to a story last night, or, whatever, some relaxing sounds. Well, then tonight when I go to, decide whatever I'm doing, it's going to say, how was your sleep? And then I rate it. And then it gives me kind of like a consistent idea of like what's working, or I can reflect back and go, ooh, 2 nights ago, that was horrible. Right. And then, maybe find what the correlation is between that.
Right. Yeah. So if you're going to be tracking something like with your sleep, I would recommend that right when you wake up, that you just have a piece of paper or your app open, like by your bedside, and just put your stuff in. Like, what time do I think I went to bed last night? What time do I think I fell asleep? What time did I wake up in the middle of the night?
Right. Was it multiple times?
Yeah. How long did I lay in bed trying to fall asleep?
Oh, yes.
That's a whole nother topic.
Right. That is another topic.
That's a whole other topic about conditioned insomnia to the bed and different things like that. But I would say get some good information about sleep hygiene. We've talked about
from a trusted source.
A trusted source, yeah. Right. Anything that like Society for Behavioral Sleep Medicine is a good place. I don't know who you like to use, but there's a lot of good places. And then just make one change over the course of a week. Be tracking that, see how it works for you. then make another change, see how that works for you. If you get stuck or you can't hold yourself accountable to some of these things, Tiffany would be a great person to work with. She does coaching all over the United States through telehealth, over in Broken Arrow and Tulsa area. A lot of our therapists here at Legacy do sleep counseling. But a lot of times if you are doing that type of work, it's pretty short term. It's maybe 4 to 6 weeks.
Right.
And it's not really extensive work.
Right. Get back on a healthy schedule.
Right.
And it's not all or nothing. I think that's the, like Melissa was saying, like, don't give up. You know, if you are a couple of days in, you're not noticing anything. It does take a little time to get that pattern regulated again.
Yeah. So, all right. Well, nice to see you all.
Yeah.
Talk to you next time.
Thanks, guys.
Okay. Bye.